What about blood pressure? How does blood pressure work? Is your blood pressure the same all the time? I've got patients that come in and they say, well, how come my blood pressure isn't 120/80 every day? One day it's 122, the next day it's 123. Or I have patients that come in and patients that take their blood pressure 5-6 times in a row and they tell me, well, my blood pressure is different every single time. Absolutely. Your blood pressure will be different every time you take it. There's a beat-to-beat variability. I had a professor at university said the only time that your blood pressure is the same, there's only 2 times. 1, if we're not here, and 2, if you're in a deep anesthetic coma. Otherwise, your blood pressure will be different from beat to beat. But the significance is we want to be in the right range. And again, the right range is less than 140/90, unless you have diabetes. Unless you have kidney disease, then it should be less than 130/80. And the blood pressure is kind of interesting. During the day, your blood pressure is stable, and then when we go to bed at night, what happens is our blood pressure goes down. And this is part of the biorhythms. We call it in medical terms circadian cycle. Your blood pressure goes down. But what happens in the early morning hours is your blood pressure starts going up. And this causes a blood pressure surge. Now, the blood pressure surge is a good thing because it gets you ready for the next day. But what happens when you have high blood pressure? Studies have shown that if you have high blood pressure and you have a high blood pressure surge, the result is increases your chance of having a stroke. The majority of heart attacks occur in the early morning hours with this blood pressure surge. So I have this one medical student says, well, if they occur in the early morning hours around 5 to 6 in the morning, why don't we all sleep in? But it doesn't work that way. So we can't avoid the morning surge. So it's important to take medications that give you a full 24-hour protection. You don't want medication that will give you 22-hour protection. Then you want medication that'll give you 24-hour plus protection. Because what happens if Monday to Friday you take your medication at 6:30 in the morning? Great. And then on Saturday you don't take your medication until 8:30 because you sleep in. So if you're thinking, well, if I have medication that gives me just barely 24-hour coverage, what happens Saturday morning? So essentially Saturday morning, your blood pressure is going to rise because you're not going to have total coverage. So when you're looking at medication, which medication should I get? You want medication that's once a day and that gives you 24-hour plus coverage. Some medication that will help you guard against that morning surge.